In this video, we will talk about some common chromosomal aberrations. So these are diseases relating to the chromosomes. So yeah, let's start. The first one we have is chronic myeloid leukemia, or CML. Let me just get my mechanical pencil. I should have prepared this before the video. Anyways, so CML, this is basically cancer because of the word leukemia. Leukemia is cancer of the blood. So cancer starts in the myeloid cells of the bone marrow and it spreads to the blood among other parts. The myeloid cells, says here monocytes or granulocytes, myelogenous. Myeloid or myelogenous, it's the same thing. Um, you can say this is chronic myelogenous leukemia. It's the same idea. They're just different words. Leukemia, we all know, again, like I said earlier, this is cancer in the blood or and in the bone marrow. Don't forget bone marrow. But more commonly, it's cancer of the blood. Chronic, from the word chronic, that means it's slow growing. Um, Unlike the opposite, which is acute. Acute is basically when that disease suddenly appears, only for a short time. But here, it's chronic, so uh, this becomes cancer for a long time until eventually it kills you. Um, and yes, myelogenous, referring to the myeloid cells. That's where the cancer starts. So, what are the phases of CML? So first, we have the chronic phase. We have mild symptoms. This is usually the time when you get diagnosed with CML. And treatment, what does TTT mean? Um, I know there is a word for that. This is the abbreviation. But essentially, the idea is um, during the chronic phase, when you treat your CML, uh, it's there's a good chance that you will recover. Because medications are most responsive, or basically medical treatment is most responsive during this phase, the early phase. The second phase is called the accelerated phase. So, what are symptoms? You have splenomegaly. This basically means the enlargement of the spleen. And you have basophilia. You have excess basophil cells. And yes, you have an increase in the number of immature cells. So yes, moving on to the worst stage, let's say in other cancers, let's say it's equivalent to stage 4 in a way. But yes, this is called the blast crisis. So more than 30% of your cells are immature cells. In other words, blast cells. That's what they call it. Blast and immature are synonymous in the context, in the concerning context. And your CML becomes AML or ALL. What do those mean? I recall the complete name of AML, but ALL, not much. I don't think I remember it. AML is basically acute myeloid leukemia. So earlier, C stands for chronic, A stands for acute. So it is said that AML is a worse, um, well, it's basically worse than CML because you get it all of a sudden. Among other reasons. I know there are better reasons to that. Let me just search the complete name for ALL. Give me a while. Okay, so this is acute lymphoblastic leukemia. So, from the word lymphoblastic to the lymphocytes and blast cells, I think that's the implication. This is a type of cancer in which the bone marrow makes too much lymphocytes. So, the lymphocyte is a type of white blood cell, by the way. And yes, okay, that's all I'm gonna say. It's refractory to treatment. If the chronic phase, if during the chronic phase, treatment is very easy to do. during the blast crisis phase, treatment is almost pointless. That's the thing. And overall, the 5-year survival rate for chronic myeloid leukemia is 90%, so it's pretty high. But if it's AML, that's definitely lower. What do these percentages mean? Um, from my understanding, if I recall correctly, coming from CML, you have a 70% chance of developing AML. And that basically means that ALL is more rare. So you have a 30% chance of developing ALL, not AML. Okay. Um, Myeloid cells goes to monocytes. I think the implication is that myeloid cells are, well, yes, they are a kind of monocyte, I believe. But essentially, all of these are white blood cells. What is CML essentially? This is the, well, in explanation, it is the reciprocal translocation between chromosomes 9 and 22. So as a result, this is a specific set of numbers, 9 and 22. So the result is there is a fusion of two genes, BCR and ABL1. The hybrid gene is BCR-ABL1, in other words called tyrosine kinase. This is the Philadelphia chromosome 22 post-translocation. This gene instructs the development of CML. So this is the one responsible for causing you to advance um, to, well, yes, coming from, for example, coming from the chronic phase, you advance to the accelerated. Coming from accelerated, you go to the blast crisis. So yes. What are risk factors for this particular aberration? So you have a higher risk of developing CML if you are male, if you are exposed to radiation. Um, Specific groups of people, for instance, who are constantly exposed to radiation, whether you are a radiologist, I think that's the case usually. You have a higher risk of developing cancer in general if you get exposed to radiation on a regular basis. And yes, if you are an older adult, let's say between 40 to 60 years old, and yes, you have to know that family history is not a risk factor for CML. What are the symptoms? So we have increased white blood cell count. At the same time, you have a reduction in RBC count or red blood cell count. When it comes to platelets, the count fluctuates. And yes, as stated earlier, during the accelerated phase, at least you have a higher chance of developing splenomegaly during this phase. So that's a symptom. And you have continuous bleeding. It makes sense because leukemia, again, is cancer in the blood. So you constantly bleed and you have recurrent infections consequently. Now, what is the solution? What's our how do we diagnose leukemia or CML? So we undergo blood type test. So you have to look for an increase in white blood cells because again, that is a symptom. And also it helps to have a bone marrow biopsy, basically taking a tissue sample from your bone marrow and seeing if it is malignant or what's the other word? Benign. I think that's the I think that's what you do when analyzing a biopsy in general. And yes, cytogenic analysis, you're looking for the Philadelphia chromosome, the one that instructs the development of CML. And okay, let's talk about treatment. So we have tyrosine kinase inhibitor therapy. So it's self-explanatory from the word inhibitor. It inhibits um, the, well, I suppose the production or the increase in influence of tyrosine kinase because it does worsen the condition. So it develops CML. So By inhibiting it, CML would not worsen. So that's one treatment. Also, chemotherapy would help, and immunotherapy. Immunotherapy, for example, adjuvant therapy, interferon, to be more specific. From my schema, immunotherapy is usually more effective than chemotherapy. There is this thing in chemotherapy, one characteristic uh, that chemotherapy does not have, although both are effective kinds of treatment. But chemotherapy is, well, in a way, it poisons your healthy cells. I think that's the word for it. That's a phrase. Immunotherapy, on the other hand, um, I don't think it damages as much as chemotherapy, but it delivers the same effect, or at least something similar, that helps address chronic myeloid leukemia. Okay, second in our list is cri du chat syndrome, in other words called the 5P syndrome, or the cat's cry. So this results from the deletion of the short arm of chromosome 5. It's better if there was an illustration so that you could see the short arm in specific. But yes, it's not here. Two genes that have been localized to the critical regions. This causes SEMAF and CTNND2 genes to lack. The SEMAF is in charge of the development of axons. The axons, this is a similar word. This is intended to allow for signal transmission around the body. So in neurology, this is a big word. CT and ND2, this is associated with the nervous system in the part where memory is affected. So, what are risk factors? So, old mothers, there's a higher chance for meiotic errors. If, well, not specifically old mothers, if they conceive children at their old age, there's a good chance that the child would have this specific disease. And yes, based on what's stated here, I think the implication is that for children, or basically babies who were born, if the risk of developing cri du chat syndrome could also be affected by the environment. So if there is poor social and educational environments, um, the brain is not stimulated enough. I think that's the idea. Okay, symptoms. So we have cardiac defects. So this one is definitely not caused by the environment factor. More likely because of being conceived by older women. Also, another symptom is hypotonia, or a decrease in muscle mass. And there is also microcephaly. The head is really small and the face is deformed. And yes, extreme mental retardation, that's also a symptom, as unfavorable as it is. And yes, let's move to the treatment. So we have therapy for speech, behavior, and motor. We have custom educational support. This is definitely going to be expensive. And also medication and behavioral management. Since again, there is one symptom is mental retardation, so behavioral management has to be one of the treatments. It makes sense. Okay, let's move to diagnosis. So we need a physical exam to test for what's this? Inguinal hernia, diastasis recti, and epicanthonal. We also need genetic tests. One, for instance, is called FISH, or fluorescence in situ hybridization. I think this is relatively new, this test, but essentially it's intended to locate DNA sequences, and detect chromosomal aberrations in general. And fortunately, Cri-du-Chat syndrome is one of them that this test detects. So you're looking for deletions or translocations, that kind of sort. Okay, anything else? Okay, let's move to the next page. Okay, we have Down syndrome. I believe this disease is more popular than the previous two that has been mentioned. So, in other words, Down syndrome is called trisomy 21. From the word 21, you have an extra chromosome 21. And it is characterized by delays in physical and mental development, as well as an increased risk of health problems. So, we have three types for this specific aberration. We have trisomy 21 itself. So, three copies of chromosome 21 instead of two in all of the cells. This is usually the kind of Down syndrome that you will diagnose as a doctor or as a medical professional in general, because it encompasses 95% of cases. The other two are a lot rarer, as you can see. This one is 3% only. This one is 2% of all cases. Let's move here. Translocation Down syndrome. So, a segment of one chromosome relocates to a new locus on the same chromosome or two non-homologous chromosomes. So, that's pretty technical. The third one, mosaic Down syndrome. Some cells have an extra chromosome 21. In other words, there is a mix of two types of cells. Some of them are 46, some of them are 47. That's not supposed to happen. Ideally, it's only supposed to be all 46. 23 from the father, 23 from the mother. So yes, extra chromosome 21, that makes it 46 plus 1 equal to 47 in some cells. So, how do we diagnose Down syndrome in general? So we have two in this list. One is detection during pregnancy. So we have prenatal screenings, diagnosis tests, and ultrasound. Also, we have karyotype blood test after birth. Risk factors. Um, so children who were born, women who conceive children when their age is 35 or older. So there's a higher chance of conceiving a child with Down syndrome. And what are symptoms? So we have physical, cognitive, and behavioral um, what is this? Imparities? Is that even a word? I've never heard that before. I don't remember writing that. Second is ultrasound. What's this? Differentiation. But yes, you might find it. You might find signs for Down syndrome via the ultrasound. And of course, there is a flat face, short neck, small ears, hands, feet, because they're underdeveloped. And yes, eyes are almond. What's treatment? What's for the treatment? Therapy. I'm not sure why I wasn't more specific than that. But yes, that's it. Next page. Okay, so we have two chromosomal aberrations here. Let's start first with the one on the left side. So, Klinefelter syndrome. In other words, called the XXY syndrome. This is only exclusive to males. So, males who were born with an extra X chromosome. So, supposedly, a male will only be XY, and the female would be XX. But here, the male is XXY. That's why it's called XXY syndrome. So, there are 47 chromosomes instead of 46. So, what are risk factors? The first risk factor is, well, it's random. You can't really fight nature in that regard. And there is an increased risk when the mother is old. So when the mother is old and she conceives, there's a good chance. So so far, based on based on the risk factors that we have talked about in various chromosomal aberrations, usually this is a universal risk factor. So, if a woman is old and she conceives, there's a good chance for the development of a chromosomal aberration, regardless. So, this is one of them, that's for sure. So, what are symptoms? So, there are problems speaking, hand tremors, reduced body and facial hair, decreased sperm count, and decreased libido. Uh, Sorry for the informality here, but the penis is not big. The testes, the amount of sperm you have as someone who has Klinefelter syndrome is relatively low, and it makes sense because libido is low. Although I'm not sure if these two are directly related or if there's a proper correlation to them. But yes, you get the idea. We have weak bones, lower muscle mass, decreased muscle mass, enlarged breast tissue. This is a, let's say it's a hallmark symptom for Klinefelter syndrome. Although there can be symptoms here that may not be reflected to the patient. I have seen someone who has enlarged breast tissue, but overall, there's no, that person doesn't have problems speaking. Or maybe I haven't observed yet enough. But yes, this bottom line is this is a solid symptom. And yes, there is an increase in belly fat. So what's for the treatment? So we have testosterone replacement therapy and we have speech and language therapy. This is to address specifically the problems in speaking. Okay. From my schema, regarding enlarged breast tissue, I think this is because of estrogen. Um, I am yet to confirm, but from what I remember, too much estrogen causes enlarged breast tissue. So it makes sense for uh, testosterone replacement therapy to be one of the treatments. So yes. Next, we have Patau's syndrome. In other words, called trisomy 13. So we have an extra copy of chromosome 13 in each cell of the body. So this is very rare. 1 in 10,000 babies. So this is a massive abnormality. This syndrome is very serious. You have 3 chromosome 13s instead of 2. And the risk of death is really high. So most likely the child would die already. And that's really sad. What are risk factors? By the way, I think Patau syndrome is exclusive only to female babies. Let me confirm that. Give me a few seconds. But I remember when I was making this reviewer, one of these chromosomal aberrations was only exclusive to females, while the Klinefelter, the one here, is only exclusive to males. Let me just confirm. Okay, so it's not necessarily only exclusive to females. It says here, much more commonly affects females than males. So I guess we'll take that as an answer. That's according to the Mississippi State Department of Health. Okay. What are risk factors? So there is non-disjunction during meiosis 1 or 2. I think what's being referred to is when mentioning meiosis 1 and 2 is during the process of oogenesis. I'm not sure. The second risk factor is translocation. So a part of chromosome 13 attaches to another chromosome. That's what happens. And let's talk about the symptoms. Wait, before the symptoms, let's go with the 3 types first. So We have full trisomy 13. This encompasses 95% of all cases. The third copy of chromosome 13, there is a third copy of chromosome 13 in all cells. On the contrary, in mosaic trisomy 13, which encompasses only 5% of cases, only some cells have a third copy of chromosome 13, not all. So that's the difference between the first and the second type. The third type, partial trisomy 13, encompasses only 1% of cases, so this is the rarest. Part of the third copy of chromosome, sorry, let me just restate that. So a part of the third copy, what's this supposed to mean? Partial, right? So from the word partial, part of third copy chromosome 13 in cells. Okay. Let me just research that to be sure. Maybe I think the implication here is that although while the first two types are about um, each chromosome here, all chromosomes, all cells have a third copy of chromosome 13. Here only some. But in all of the cells here in this case, they essentially have. Wait, but how's this gonna be different from full trisomy 13? Perhaps here, only a part of. You know what? Let's just move on. Missed opportunity. I should have discussed this right after I had the lecture. Uh, right after our teacher made the lecture on this. Okay, let's just move on. Symptoms. We have organ abnormalities. We have facial defects, defects in the heart and the brain, both critical organs of the body. Decrease in birth weight. It's hard to breathe for them. Growth is restricted. For those who survive, although the risk of death is really high, there are still some who survive. And what happens is when they grow, as they grow, um, usually they're really short. So, yes, that's a symptom. Structure issues, I think that's related to growth as well. And when it comes to treatment, we have therapy for, well, yes, physical therapy, because again, they have organ abnormalities. It's possible for them to develop um, issues with the spine, among other important organs. So, physical therapy, speech therapy, since their brain also has defects, we have to expect the worst. We need medical monitoring and nutritional support. In other words, for instance, special feeding. So it's very expensive to treat patients who have, well, in general, patients who have chromosomal aberrations. Okay, next. Is there a back page? Okay, so this is the last. After this, we're ending the video. So we have Turner syndrome. In other words, called monosomy X or 45X syndrome. So this is only exclusive to females. So I think this is the chromosomal aberration I was referring to. I recall that one of these aberrations are exclusive to females only, and this is the one. So it affects 1 in 2,000 baby girls. So the chromosome variation in conception is random, and one X chromosome is missing or incomplete. That's what defines Turner syndrome. That's why we have the word monosomy, missing chromosome, or missing or incomplete. So again, females are XX, right? So in this case, at least in monosomy X, the first type, you only have one X chromosome. The other one is missing. So it's very destructive. So yes, we already talked about the first type. So having one normal X chromosome instead of two. And this encompasses 45% of cases. The second type is mosaic Turner syndrome. Some cells have complete two X chromosomes, but some only have one X chromosome. This happens, this is usually 30% of all cases. For the third type, inherited Turner syndrome, so patients are born with it. Um, well, it becomes passed down from the parents who also have it. So, yeah, this one is very rare. It's the rarest compared to the other two types. So, part of the X chromosome is missing. Let's talk about the risk factors. So, it's definitely not linked to the mother's age. Among among all of the chromosomal aberrations we've talked about, this one is not because of the mother's age. So, yeah, uh, that's the distinction. And yes, there are no factors according to this. There are no factors. That makes this a lot more dangerous, I think. And yes, let's talk about the symptoms. So height decreases, ovaries and the breasts are undeveloped. Periods are inconsistent. There is a decrease in sex hormones, so decrease in libido. Pubertal failure, since yeah, puberty allows for the introduction of the human body to, well, being sexually active in general. So these are, let's say, these happen at the same time, if you get what I mean. There is congenital heart disease, there's curved spine, in other words, scoliosis. Bones are brittle, in other words, osteoporosis. So there's a good chance that patients who have Turner syndrome may have good language and reading skills, but when it comes to the behavioral and social factors, the outcome is not ideal. It's not okay. And what are associated conditions to Turner syndrome? We have diabetes, obesity, lymphedema. Let me search what this means. I want to know also. Okay, so this is swelling caused by a buildup of lymph fluid in the body between the skin and muscle. Okay, how is this different from polio? So basically, a limb is enlarged, something similar to an elephant's limb. Okay. There is bleeding in the guts, the intestines. So, yeah, the blood vessels in the intestines. The aorta is narrower, so as a consequence, there is an increase in blood pressure. It's easier for them to have high blood pressure. Again, the aorta, I believe this is the largest artery. Is it? Let me confirm. Yeah, that's the aorta because it's red, I remember. Um, Decreased thyroid. I think the implication here is hypothyroidism. So obesity is a risk factor also if we're talking about hypothyroidism. Hormones, I think it's called hormones. Is it? Whatever is produced by the thyroid um, is insufficient. So that's why it's called hypothyroidism. Increased blood pressure, that's equal to hypertension. Let me just confirm about hypothyroidism. Yes, the thyroid gland doesn't make enough thyroid hormones to meet your body's needs. I mentioned hormones, that is correct. I confirmed it already. So, yeah. Um, regarding the treatment for Turner syndrome, well, there is no cure, but there's therapy. We have hormone replacement therapy. This is done at puberty and for those with osteoporosis. So, what are female hormones? We have estrogen and progesterone. Although I believe these are not exclusive to women only. I might be wrong. But yeah, it's safe to say that these are reflected in a woman in general. And yes, checkups to address symptoms, the band-aid solutions, basically, growth hormone therapy, more specifically somatropin. And if the patient who has Turner syndrome wants to have children, there has to be assisted conception. I think that's the case here. Because again, because of inconsistent periods, underdeveloped ovaries, underdeveloped breasts, undeveloped, sorry, um, decrease in sex hormones, and pubertal failure, it's not easy for them, definitely, for them to conceive. It's not easy to be, fertility is an issue for them. So, assisted conception, we have egg donation and IVF, or in vitro fertilization. Okay, that's it. My reviewer is done. After this, no more. This ends my series on grade 12 biology. Again, the reason why I've made the series is because unfortunately, I already made a video on this topic, but the audio cannot be heard. I tried reposting the same video twice before, but it didn't work. So, yeah. Thanks for watching. See you next time. Yes. Next video will be about something from the past. As you can see, this is an old reviewer. Something I made back in 8th grade. If you want to check it out, I'm going to make a video to it. It's my grade 8 nutrition reviewer. Shout out to Sir Robbie. Okay, I'll end this video now.